Viewer named Michael sent this email yesterday about a New York Times article. Pat, this reminded me of an episode you ran a few weeks, maybe months ago, mental illness and the lack of authority to do anything about it. If you didn't see it, I thought you should be made aware of what Mayor Adams is doing in New York City. Well, thank you, Michael. After we read the report, we thought it was certainly worth your time. So here it is, New York City to remove mentally ill people from streets against their will, and then the subheadline. Mayor Eric Adams directed the police and emergency medical workers to take people they deemed too mentally ill to care for themselves to hospitals, even if they posed no threat to others. Now, you heard the owner of the Portland preschool mention this a little bit earlier during our big story. Mayor Adams argues the city has a moral obligation to help people with severe mental illness, even if they don't pose a risk to others. He said, "The common misunderstanding persists that we cannot provide involuntary assistance unless the person is violent. Going forward, we will make every effort to assist those who are suffering from mental illness." Here's how it would work, and a reminder, we're talking about New York City here, not Portland. He said first responders will assess people in public spaces on a case-by-case basis to see if that person is able to provide basic needs for themselves, things like food, shelter, health care. If they can't do those things for themselves, or if there is no presence of unawareness or delusional misapprehension of surroundings or delusional misapprehension of physical condition of health, then the first responders would have the grounds to force that person into a hospital to get help. The mayor emphasized the importance of this plan with a quote that we think may remind you of some of the things you see in Portland day in and day out. "The man standing all day on the street across from the building he was evicted from 25 years ago waiting to be let in. The shadow boxer on the street corner in Midtown mumbling to himself as he jabs at an invisible adversary. The unresponsive man unable to get off the train at the end of the line without assistance from a mobile crisis team. These New Yorkers and hundreds others like them are in urgent need of treatment and often refuse it when offered. The NYPD, EMS staff, and other medical personnel are going to start training immediately in an effort to, quote, ensure compassionate care. Homeless folks with severe mental illness are often discharged in New York from hospitals just a few hours or maybe a few days after their condition improves. Mayor Adams said in his plan now, he'll direct the hospitals to keep those patients until they're stable and only discharge them when there's a workable plan in place to connect them to ongoing care. That sounds like something that we've heard time and again here at home. And it's worth noting, Mayor Eric Adams in New York is a Democrat, but the Times article points out he's using an argument often heard across the aisle, that growing disorder calls for more aggressive measures. They also write that left-leaning advocates in the Big Apple say deploying the police as auxiliary social workers may do more harm than good. Those same advocates have already warned that Mayor Adams' plan will likely face legal challenges, but it's an idea and a story that is certainly worth your time, as we all search for solutions to homelessness and mental illness problems here on the other side of the country. Now, as I mentioned earlier, our own investigative reporter Evan Watson did a full series on this idea of forced care or civil commitment here in Oregon and Washington. You can check out his series. It's called Uncommitted. It's explored with high standards of forced care, and it's worth catching up on if you missed it. Watch it now on KGW YouTube channel or on KGW Plus. That's our streaming app on Roku and Fire TV. And we know you have lots of thoughts about New York City's mayor plan to force people with mental illness into the hospital. I can just sense your support or fierce opposition already, and I'd love to hear what you're thinking about this. Do you think it's a step in the right direction, or maybe a step or several steps too far? Do you think it puts too much strain on an already taxed hospital system? Let us know. Send me an email to thestory@kgw.com or call and leave a voicemail. 503-226-5090.